It's Hispanic Heritage Month, and on today's Mental Health Monday, we're talking about how Hispanic Latinx communities show similar vulnerability to mental illness as the general population, but they face disparities in both access to and quality of treatment.
And this morning, we're joined by psychologist and 9 News parenting expert, Dr. Sheryl Ziegler. Good to see you again.
Nice to see you.
You have your orange on for the Broncos.
That's right.
Yes.
Yay.
Yay.
She was at the game.
That's right.
Hey, so why are these communities facing these disparities?
Yeah, there's actually a couple of reasons that I think are really important to talk about. The first one's just a language barrier. We have a lot, when we talk about Latinx communities, that could mean anything. That means so many countries. It means Latin America, South America, could be Spain, for me, Puerto Rico and Cuba. So that means a lot of things. So A, not even all Latinx communities speak the same language. And then B, there's definitely not enough therapists and mental health providers that speak Spanish or Portuguese to be able to treat them. So that's one of them. Another big barrier is poverty. So we know that unfortunately, there's a greater percentage of Hispanics that are in poverty. And so when you have poverty, unfortunately, you have increased levels of mental illness. And also, even if you have insurance, which often they don't, certainly if you're a family who is immigrants, those children still may not have insurance. Transportation is a huge barrier to treatment. So those are two really big reasons why.
What can families do if they actually need treatment? What resources are available?
So one of the things we know is that Hispanic families, about a third of them actually receive treatment for issues that they need, compared to the general population was still just a half. But the things that they can do are, you can ask for an interpreter. You can seek out, and I think we're going to share resources, places where you can try to find bilingual therapists. You can also allow even your children, your middle children, or even your young adult children to help get those resources, because that's going to be more comfortable for them. There's a cultural barrier in terms of, do we share this information with other people? Maybe we just go to our faith communities. Well, you can go to your faith community, but try to see if they have actual professional resources when needed there. So there's a couple of different things they can do, but also children of immigrants do have access to the Affordable Care Act, can get insurance in that way, but oftentimes people are really scared. They're scared to do that for legal reasons. And so I just really encourage people to try to seek out health insurance and try to get bilingual care when possible.
There has been such a push nationwide to get more emphasis and more money on mental health services. Is that getting down to these communities at all?
It is, but we have such a shortage of therapists in general, and truly cultural competence, because even if you're just bilingual, you actually do need to understand the difference between maybe a Mexican family and a family from Venezuela. There's going to be differences. And so there's a lack of therapists, but really the cultural competence piece is something that on the professional side, we all need to make sure that we are competent in the treatment that we are providing and not having misdiagnoses, which also happens a lot in diverse Hispanic communities.
Yeah. Well, we're going to put all of the resources as well that you've shared with us on our website at 9news.com, because there are plenty out there, and really some great tips and better understanding for why some communities are really, impacted more than others.
Yep.
Yeah.
All right. Dr. Ziegler, good to see you.
Thank you.
Thank you.